I express my sincere love and gratitude towards the total office bearers of this esteemed institution, NIMHANS, and especially Dr. Ramakrishna sir, Dr. Santosh sir, everyone who gave me this golden chance to present my views regarding autism and multidisciplinary management. Without much introduction, let me introduce my topic. The topic name is Agastya. Agastya is an acronym. Actually, the scope of integrated treatment approach in autism spectrum disorder. Here the integration is with the so-called conventional therapies in autism spectrum disorder along with Ayurveda. And this is the first evidence-based multidisciplinary Ayurveda treatment protocol in the world for autism spectrum disorder. This is majority of the program of Agastya is sponsored by Government of India, Department of Ayush. These are the team members of Agastya research team, and these are the research workers and guidance, people who are guiding us and people who are working with us towards this golden aim. All we know, the traditional medicine, especially Ayurveda, has long history with an epistemology. Why? Because these are the two important prerequisites to approve a traditional system globally, to consider into the integration as well as for the research by World Health Organization. So Ayurveda has long history, all of you know, and it has good epistemology, and it is centered to the Indian culture. A culture of a given ethnic population, you know, this is either directly or indirectly governs and controls the health of that given population, as well as that population basically relies this tradition to treat their primary health care needs. So to treat a disease in a given population, nothing has to be imported from outside. Only thing is that your basic civilization has to be revitalized and it has to be validated scientifically. This is the effort what we are doing in Ayurveda fraternity right now. If you see the herbal or traditional medicine usage across the world, you can see in majority of the countries, more than 80% of the people are using traditional medicine or herbal medicine for their primary health care needs. Of course, in so far Ayurveda is concerned, the use of Ayurveda is very limited, but in India almost everywhere Ayurveda is being used, either in the form of medicine or in the form of lifestyle or in the form of any other activities of daily living. If you look into the use of complementary and alternative medicine in autism spectrum disorders, you can see this study, more than 80% of the people globally accept complementary and alternative medical usage for their management of their children with autism spectrum disorders. If we look into the Indian statistics, you can see that complementary and alternative medicine, especially the Ayurveda, is being used by majority of the patients as well as the doctors for their healthcare needs. Why Ayurveda is fitting into autism spectrum disorders? Why? Because being it is a traditional medicine, common man first think about Ayurveda in India. Moreover, all we know, our human body is non-linear. Non-linear means it does not follow mathematical equations. Ayurveda is also a non-linear science. It goes against the common mathematical equations. 1 plus 1 may not be 2, it may be 100 sometimes. Similar is the condition with autism spectrum disorders. You cannot predict the behavior of autistic children, the metabolism of autism, even the gene mutations in a given autistic child. That is also non-linear. So Ayurveda is a non-linear science, human body is a non-linear, and autism spectrum disorder is a non-linear disease. While we are looking into the Ayurveda perspective, while dealing with a health condition or a disease, it can be seen that Ayurveda people are not looking into an individual as a compendium or a composite of 38 trillion of cells. No, it's something beyond that. This group of cells or this organism is situated in a given society. The social condition has prime variability. In a given environment, that environment is having conspicuous relationship with his health as well as his disease. In a given space and time, those are very important. This is the holism concept which is put forward by Ayurveda, not only Ayurveda, almost all the traditional medical systems. So we are not looking into the human specimen as a group of cells, rather an organism which is situated in a given society, in a given environment, in a given time and space. So Ayurvedic view on autism spectrum disorder goes like this. Actually, the main variable we are considering are the soma, the total cells, and the sense organs, psyche, and beyond that, a level of consciousness is being managed or considered in the management of autism spectrum disorders. So the environment, management of consciousness, management of thought process, and activities of daily living and food and drinks. These are the chief variables what we are considering while managing a case of autism spectrum disorder. We conducted a plain survey among the parents who are attending a multidisciplinary center where Ayurveda is being practiced in our college and in some other centers too. You can see that we have asked them why you are opting Ayurveda. Interesting answers are, even though it is not right, they are believing that it is free from side effects. It's not true, but the people have such belief. And other conventional treatments not seems to be much effective. These are only their subjective feeling. This Venn diagram shows 37.1% of the total 249 respondents. They told that the so-called speech therapy, behavior therapy and occupational therapy are not seems to be effective for them, and they believe Ayurveda treatments are effective. This is the reason, and this is the background what I told the initial slides. The people are thinking about their own civilization tinged medical system, their traditional medical system for their primary health needs. And we have asked, why are you doing Ayurveda continuously, even though you opted it, but you are continuing it for a long time. It is for 1 year, 2 years, and even beyond that. 84% of people are opining that improvements in their child's condition with Ayurveda treatments, and also obviously 38% obeying that according to the advice of the consulting doctor. There are people who discontinued Ayurveda even after coming over here, after getting their multidisciplinary approach of management. But majority of the people discontinued not because of the financial issues, not because of their improvement concerns, but there are several other issues which are non-medical. For example, they are unable to quit their home to stay here for 1 year. The long 1 year has to spend, or 6 months. So such a long time spending in this specialized center is very difficult for them. There are family issues. All these are the different reasons for the discontinuation of Ayurveda. With this in our mind, let us see what is Agastya protocol. Actually, this is a research protocol. This is an open clinical trial and multi-center study is in progress. So actually this is a short communication. The study is not finished yet. Agastya is actually administered in addition to speech therapy, occupational therapy and behavior therapy. So it is multidisciplinary with an equal importance to Ayurveda. This is the expansion of Agastya. Ayurveda drugs, gut therapy protocol, because Ayurveda believe that most of the diseases are originating, or it is getting that much duration or progression or even relief with the connection with the gut and Ayurveda standards of living. As I told you, we are looking into the social environment, training of the parent. We are not treating only the child, but we are treating total family and yogic assistance. So these are the expansion of Agastya. Ayurveda drugs, mainly herbal drugs, mainly intended to relieve the ama, which is a unique concept of Ayurveda. Ama in Koshta, ama in Dhatu. Otherwise, in general terms, in common man's understanding, it can be said that the main Ayurveda drugs are related to detoxification of the total human body and correction of whole metabolism and neuroendocrine characters. If you are doing ama chikitsa in Dhatu level or Koshta level, it invariably connected to or invariably corrects the altered metabolism as well as altered neuroendocrine mechanism. Usual targets of metabolic markers in our study by ama chikitsa are serum ammonia, that is quite increased in many of the autism children. Serum lactate, serum pyruvate, vitamin D deficiency. We are not looking into the deficiency as reduced or it's a substratum for supplements. Rather, even though we are getting enough sunlight, even though we are getting enough diet, still 98% of the Indian population is deficient of vitamin D. Why? Because their system is unable to handle the vitamin D total metabolism. And gut therapy guidelines. Gut therapy and guidelines are ama in Koshta. The usual target what we are focusing in children with autism spectrum disorders are their mesenteric lymphadenopathies. Majority of the children who are suffering from ASD are suffering from this issue of ileocolitis, mesenteric lymphadenopathies, gut dysbiosis, the altered equilibrium of microbial flora of gut, and thereby leaky gut syndrome. Even before the complete digestion, the macromolecules are getting absorbed into the system, and gastroesophageal reflux disease and constipation. These are the areas where we are concentrating upon for the gut therapy. In gut therapy, we are having customized protocols. For example, these are giving the example, the Chitragadi Kwada, Amrudarishta, all these are the medications whenever the nausea, headache, food sensitivity, respiratory problem. That means when the Vayu and Pitta is situated in the Amashaya, the upper GI tract, we are giving another medical formulation. If it is in the lower GI tract, there are some other formulation like Kaidariadi Kwada. In food sensitivity, increased tiredness, evidence of any Dhadugata Ama. All these are managed by Amrudottaran Kwada and Villuadi Guliga. So these are the different protocols what we are using for gut therapy protocol. And in gut therapy also we are giving a lot of lifestyle guidelines. I will give you certain examples like take bath before main food. Use maximum vegetarian food, because even evidence based articles, a large body of literature are supporting that the animal protein are increasing the hyperactivity in autism children. Time gap between sleep and meal should be minimum 1.5 hours. Otherwise, there will be and increased problems of irritability. Avoid milk and milk products, wheat and wheat products like. I will give you one unique concept of Ayurveda that while we are sleeping, our biological channels of digestion, absorption, everything will shrink. During the sleep, that will shrink. During wakefulness, it will open. Simply, if you are taking the sleep immediately after our last meal, what will happen? All the biological channels will come down and they will shrink. The basal metabolic rate will come down. And this is more than sufficient to hamper certain metabolisms in our human body. Now the Ayurveda standards of living and yogic assistance. This is to ensure the consciousness intact in its functioning, to ensure the biological rhythm intact. For example, there are 6 activities we are customizing in all family members, including the autism children, that waking up, sleep, food, diet, exercise and bath. This should be done in a correct time. Otherwise, our biological rhythm will be in confusion. If you are keeping the correct time of this dinacharya, plus or minus 20 minutes of gap, and your pineal gland will be sensitive and they will make a harmony and biological rhythm in the human body. So that biological rhythm is very important to maintain homeostasis in children, and that itself is more than sufficient up to some extent to manage the metabolic corrections. So the customizing activities of daily living and living as per the seasonal changes ensure the changes and homeostasis of the consciousness by applying the yoga assistance not only to the family members, to the autism children even. And these are the different photographs. We are giving training to the parents how to do certain procedure based therapies of Ayurveda. Detailed workshops for 7 days duration we are giving for parents. Workshop training on minor procedure based therapies of Ayurveda and food selection through Ayurveda, Ayurveda feeding practices, Ayurveda culinary, teaching of lifestyle guidelines of Ayurveda. These are the different syllabus of these detailed workshops of 7 days duration. Then workshops training on minor procedure based therapies of Ayurveda, like we are doing a lot of certain unique massages and unique herbal paste applications in different parts of the body to make sensory integration, to reduce the hyperactivity, for the language improvement, for the improvement in the attention and concentration, and to make the child more socialized. And moreover, the sensory integration therapy is highly effective in Ayurveda by applying different sensory diets. And brain pathologies like mini column pathologies are getting addressed hypothetically by these procedure based therapies of Ayurveda. In that 7 days procedure, in workshops, we are teaching them dubana, like herbal fumigation. The herbs will be fumed before taking the sleep inside the bedroom. And this is quite good for the nasal or olfactory sensory integration issues. And Shirodhara, we are doing the home-based Shirodhara for the children. The treatment will be done by the parent. And there are certain powder massages. We call it a Suddvartana, powerful sensory integration therapy. So far the proprioception is concerned, skin concerned. So this is a powerful sensory integration therapy in autism. And Abhyanga, the oil massage. These are also taught to the parents how to do, when not to do. And everything will be done under the medical supervision only. Whenever they are coming for the monthly checkup or monthly review, we will give them that you give this much Shiroleba, you give this much Abhyanga, or you give this much Uddratana, because the management of autism spectrum disorder is a highly expensive business nowadays. And we are also teaching the parents how to make the Swarna Prasha, not the Swarna Prasha of the Karnataka practice, but we are giving some how to do the Shitoleba, that is herbal paste application over the heart. And we are teaching orofacial massage with some herbal powders, that is Mukhaleba. Orofacial massage, this improves a lot regarding the speech and language pathologies. And we are doing Pradimarsana in nasal instillation of drugs, powerful olfactory sensory integration therapy. And we are making them sit in a medicated decoction in a specified some vessels that we call it as avagaha. And music therapy, there are two types of music. We are dividing the music into two. One is invigorating type of music, we call it as Kapavadahara music, and Vadapittahara music, that is calming, lullabies like. So if some child is suffering from hyperactivity, we will give the Vadapittahara musics. That type of ragas we will select, and otherwise we will give, if the child is aloof, if the child is devoid of the speech and language, if the child is not hyperactive, we will give Kapavadahara or invigorating type of musics. And you see, these are the different results of our trial that I will show you. Only with the parental training, even without the management of the children, only with the parental training, if you look into the WHO BREF, the quality of life, that is showing a lot of percentage of improvement in psychological and social domain with high statistical significance. And in family impact questionnaire, only with this training program, with yogic assistance and training program, these are the different impacts in the family, like impact on social life, impact on marriage life, because you know, so far in autistic children, a child is concerned, the emotional environment of the family is very important for their mood and disposition, and these are the different high statistically significant areas of family impact. And one RCT is right now continuing, which is on progress regarding the gut therapy protocol, like we are assessing the gut dysbiosis. All of you know what is dysbiosis, the disequilibrium of the normal gut flora of human being, and this is quite evident in children with autism spectrum disorders. One randomized controlled trial under Agastya is in progress, and in that we are giving Ayurveda herbal drugs and Ayurveda standards of living only. Gut therapy protocol with Ayurveda herbal drugs and Ayurveda standards of living. We are subjected this to the 60 children. They are divided under two, that is control group and this test group. Test group is, both this group will be receiving, they are receiving both speech therapy and occupational therapy and the behavior therapy. In addition to that, the intervention group are receiving Ayurveda standards of living as well as gut therapy protocol. And this is the RCT which is progressing right now, and this program has been published in one peer reviewed journal that you can access. And we are taking the samples of stool of both this group for the genomic assessment. The stool sample collected, and the quality check will be done, and according to the read construction, the DNA will be isolated of the total microbiome. The DNA will be isolated and they will be subjected for 16S rRNA sequencing assessment. And my gene lab is in Bangalore, MedGenome, and their biochemical assessments in the serum amylase, pyruvate, ammonia are analyzed, and their metabolic assessments are also done. Along with that, their gut severity problem index, are also getting recorded along with their CARS assessment, childhood autism rating scale. So CARS, gut assessments along with the 16S rRNA sequencing of total microbiome of those children. And these are the main two drugs what we are using gut therapy, that is Vilvadi Gudiga as well as Rajanyadi Churnam. We subjected these two drugs into the sequencing methods of for the presence of microbial flora, and it can be seen that both these tablets and churna are having plenty of microbes. They are not subjected to the Agnipaga, they are not subjected to the heat treatment according to the pharmacopoeia. And they are having a special balancing system of microbes in such an environment, in such an ecosystem, that all these two drugs are giving good GI severity index. That means gut health problems are getting relieved by Viluadi Guliga as well as Rajanyadi Churnam, but they are containing a lot of microbes which are in an ecosystem. What does it mean? They are not simply the probiotics or prebiotics. They are having good bacteria as well as bad bacteria too. So this is an ecosystem, because co-location is a peculiarity of dysbiosis. In the presence of actinobacteria, how much bacteroidetes are present, that is very important. If the actinobacteria is highly positive, if you are supplying 100% actinobacteria prebiotics, that's not good. It should be given with some other bacteria in a co-located equilibrium form. These are the predominant genera in Viluadi Guliga and Rajanyadi Churnam. Microbiome results of 16S RNA sequencing of the stool samples. You can see these are the top 10 genus before, after, and after the follow-up, after treatment, before treatment, and after follow-up. Here the FT is follow-up treatment, AT is after treatment, and BT is before treatment. You see the harmful bacteria like firmicutes are getting reduced in their presence. And the major bifidobacterium, which is widely discussed in autism spectrum disorders, they are getting improved in the intervention group. This is the heat map for 25 genus and 25 phylum. These are the microbiota OTU. The beta diversity. You see the PCA plot. After follow-up and after the treatment, they are getting clustered in specific area. See the CARS profile, very important. After subjecting these children into two groups, see the control group CARS profile plot. See the profile plot in intervention area, that steep downing of the CARS. The mean difference is coming around 6 points certain digits. You see, this much digits of mean difference in intervention group you cannot see in ABA. You cannot see in any other techniques like PECS, Picture Exchange Communication System. You cannot see in SUN programs. So there I have compared that, I never put that slides in this presentation. If you are comparing the effect of therapy in intervention in Agastya or in Costa Chikitsa, in CARS, the mean deviation is that much challenging type and a promising type if we compare with the existing programs, which includes the behavior modification, speech therapy and occupational therapy. A high peak is observing. And GI severity index, you can see the GI severity index from this reference. See, even though the severity of the GI tract issues are getting reduced even in the control group as the time advances, but that is not the fashion if you see in the intervention group. This sharp decline of their constipation, sharp decline of their ileocolitis, sharp declining of their mesenteric lymphadenopathies, sharp declining of their all other GI related issues, because GI related issues are quite common as well as widely discussed topic in autism spectrum disorders after the publication of the notorious paper in the Lancet. All of you know the paper which is relating the GI issues after MMR vaccination, and plenty of paper denied that notorious papers, findings later on in the medical field. Even the Lancet has withdrew that that correlation between the MMR vaccination and autism issues. But still, one thing is sure, GI problems are persisting. GI problems are quite evident. Dysbiosis is evident, and a lot of prebiotic industry is flourishing in the field of autism management only for the GI issues, and thereby by the gut-brain axis, the modification of their autism behavior. And even with the lifestyle guidelines, even with the simple herbs, much improvements can be attained even in the GI severity index. This is universally accepted index. If you are looking into the Costa Gada AMA index and Ayurveda gut health questionnaire, we have also assessed that, but that is not universally applied one. That's why I have not presented that one. In that, even the minute connection of the GI tract with the general system, like tiredness, easy fatigability, everything was assessed according to this randomized controlled trial. All those are having tremendous results in comparison with the control group. So what I want to say, according to this randomized controlled trial, the dysbiosis is getting managed by an ecosystem, not by prebiotics or probiotics. Moreover, if you look into the lifestyle pattern and other activities of daily living, all these are, everything is connected to GI tract in terms of dysbiosis. If you are stressed, your dysbiosis will be increased. If you are fearful, dysbiosis will be increased. So that harmony is very well important for the maintenance of GI severity index. This is the overall results of the GI severity index. You see, the intervention group has reduced like anything, even though the control group has also mean difference regarding 1 point something. But the intervention group is having that much tremendous results when we compare with this control group. So let me conclude. Agastya protocol for autism is an emerging trend of Ayurveda in India nowadays. Its other publications are yet to be, or it is in pipeline. And empowerment of chaos of human system. We are not claiming that this is only due to the Ayurveda. We are not claiming that only due to the virtue of this herbal medicine all these are happening. These are due to the chaos. If you look into the famous article which was published in British Medical Journal, the chaos, the predicting unpredictable, written by W.J. Firth, you just read that. The chaos are there in human system, in every system, predicting the unpredictable, the effect of human biology. That empowerment of the chaos of the GI system, chaos of the nervous system, chaos of the endocrine system, chaos of the total human organism, and this chaotic relationship with nature, and the chaos which are the inherent feature of Ayurveda is the underlying magic of this effect of this protocol. And very effective outputs are reported in the initial stages. And moreover, the harmonious consciousness in the family and the children are the unique contribution of this Agastya protocol, because the emotional environment is very important so far the well-being of a child with autism spectrum disorder is concerned. All we know, E equal to MC square. It proved as wrong later. What my point is, knowledge is advancing not by repeating the non-things, but by refuting the non-things. Not a single engine has stopped even though E equal to MC square is wrong. So refute the knowledge to progress. By this, let me wind up this session. My take-home message is our human body is non-linear and Ayurveda is non-linear. Universe is non-linear and autism is a non-linear condition. Everything in the world is in an order. In that order, there is a disorder. For that disorder, there is an order. Let me once again thank to the people of the NIMHANS for this golden opportunity, as well as I do my, with due respect, my acknowledgement is there with the Department of Ayush, Government of India, New Delhi, SCSVMV University, Tamil Nadu, who gave us the opportunity to do this RCT, and IUCAM, the Center for Autism and Learning Disability Management, SIMCD, Center for Integrated Management of Children with Differential Abilities, my mother institute, PPSV Ayurveda College, Kottakkal, and the Kerala government supported me to do this work through Kerala Ayurveda Studies and Research Society, and several fundings for the Agastya protocol had been done by International Federation of Ayurveda. By this, winding up, thank you very much, namaste one and all.